Are you an autistic or AuDHDer with a history of unusual health issues, but you've not yet been able to establish why? Well, I think it might be worth considering MCAS or Mast Cell Activation Syndrome, because prevalence rates of this condition are higher in autistic people, although there does need to be a lot more research on this. And I don't think the symptoms of MCAS are actually very widely known. So I wanted to go through them today because I think some of them might resonate with some of you. And I do need to say that I'm not a doctor, I'm not a health professional in any way. I am an autistic artist with a YouTube channel, and my thoughts and opinions should be treated accordingly. So with that in mind, let's get started. So I'm going to be going through a list of symptoms that appear on the Mast Cell Action website, and it's a UK national charity which raises awareness of MCAS. But firstly, I should give you a definition of what MCAS actually is. So Mast Cell Activation Syndrome is a condition which can develop in children or adults, and MCAS forms part of a spectrum of mast cell disorders. In people affected by MCAS, chemicals called mast cell mediators are released too frequently or abundantly, and or in response to triggers that are not typically considered to be harmful, for example, foods or chemicals in the environment. This can lead to a wide range of symptoms that affect multiple parts of the body. So the first symptoms I have on my list here are nose congestion and eye watering and itching. And this is really common in people with MCAS, and I certainly get both of these. And the eye watering and itching I get mainly after eating, but I also get a really horrible sensation when I'm watching TV. So I have to use sodium cromolyn eye drops whenever I want to watch TV, which is a bit of a pain really. Next up is respiratory, so that's lungs and breathing, and symptoms include a sore throat, hoarseness, wheezing, shortness of breath and throat swelling. And yes, I get a lot of these symptoms, and for me the breathing issues are actually quite scary at times, and I feel kind of really quite constricted in my throat a lot, and I get this actually as a response to smells a lot of the time. So the worst contender for this is a bonfire smell, and I find it really difficult to breathe. And I should also mention tongue swelling here, because I don't think it's mentioned anywhere else, but I get tongue swelling quite a lot. And I think it was actually one of the first symptoms I had when I had my first big flare of MCAS in 2018, I think it was. And it just felt that my tongue was way too big for my mouth, and it was kind of scalloped all the way around. And I had geographical tongue as well, so you get kind of patches of kind of discoloration going on in your tongue, and it's such a horrible feeling. And the only thing that I found to kind of minimise this swelling is to take an antihistamine to, try and reduce that swelling in the moment. Next up is musculoskeletal. It took me ages to pronounce that word right. And this includes joints and muscle pain, osteoporosis or brittle bones, and loss of bone mass. And this really resonates with me. I get a whole lot of chronic pain, both muscular and in my joints. So it's just part and parcel of my day-to-day life really. I can't remember a day actually when I wasn't in pain in some way, and I appreciate that's probably part and parcel of aging anyway, but it's really not nice, is it, if you're dealing with chronic pain on a daily basis really. And I also have osteoporosis. I was diagnosed maybe 2 years ago, and it came as such a shock really. It's never nice to get diagnosed with anything, is it? And it's frustrating because of my MCAS. I can't eat foods that are high in calcium, so it's really difficult trying to manage osteoporosis. I am on HRT, so hopefully that is helping to manage the levels of my osteoporosis. I do have an appointment with my osteo doctor later in the year, so it'd be interesting to see if there's any improvement really. Next up is genital and urinary. So this includes genital pain or swelling, pain when urinating, vaginal pain, discharge or itching, or bladder urgency or loss of control. And I should mention interstitial cystitis here because this is a really common condition in perimenopausal women, and it's also a common symptom of mast cell dysregulation going on. So I know that I've read kind of anecdotal stories by doctors who have seen women who have presented with interstitial cystitis, so that's a really painful bladder. They've put them on some mast cell stabilizing meds and their condition has been cured. And I have to say that's happened for me as well. I've had a whole lot of bladder pain, like a vibrating sensation as well, that's really disturbing, particularly as an autistic person. You know, we hate any kind of unusual sensory stuff going on. But thankfully, mast cell stabilizing meds have sorted out this issue for me. Next up is dermographic, which means skin, and symptoms include flushing or redness, hives or wheals, itching with or without a rash, and swelling. And a really common symptom of MCAS is dermographism, and that essentially means skin writing. So it's really common just to be able to kind of lightly scratch on your skin, and then kind of red wheals will come up. So and I know of one artist actually that uses this technique to her advantage, and yeah, it's just super interesting how creative people can be actually. Next up is neurological, so that's the brain and nerves. And symptoms include headache, brain fog, so that's memory and concentration difficulties, numbness, pain or tingling skin, anxiety, and behavioural issues such as rages. And for me, nerve pain is one of my worst symptoms of MCAS. I get all sorts of nerve pain actually, but the worst is excitable neuralgia. So essentially, you've got nerves that go all over your scalp, and mine flare up as a result of food intolerance and specifically gluten. It just causes this horrendous pain, and it just takes so long to clear up. And it was one of my first symptoms, and I kept going back to my GP to say, you know, this pain is excruciating, I can't cope with it, painkillers wouldn't work. So yeah, I was delighted to discover it was food related in the end. So yeah, once I stopped eating gluten, it kind of clears up. I do get a flare every now and again through different foods, but yeah, it's much more manageable these days. I also get a lot of brain fog, which is also a symptom of perimenopause. So sometimes it's difficult to know which causes what really. But yeah, certainly I have an issue with that. Anxiety as well, and of course many autistic people and AuDHD people have anxiety going on. And I also have peripheral neuropathy, so that's pins and needles going on in my legs essentially. So that's pretty constant. And I think also POTS can cause this kind of sensation. So I think I will do a follow-up video to this one where I go through the symptoms of POTS, because again, I don't think there's actually a lot of awareness out there as to what POTS is or how it presents itself. Oh, and also with neurological stuff, I should mention that I have burning tongue going on, and it's almost all the time actually in some degree. So I will react to foods and smells as well, and I just need to include this because a lot of people with MCAS will have problems with their tongue. So it could be in the form of tongue swelling or tongue burning. So this can be a big indicator of MCAS. Next up, cardiovascular, and symptoms may include chest pain, low blood pressure, fast heart rates, and fainting or lightheadedness. And I've got a real issue with blood pressure at the moment. It is so low, and I took a reading last night, and it was, check this, 82/40, and yeah, I'm really concerned about it. And not only do I have low blood pressure, but the various medications I take for MCAS and HRT can lower your blood pressure. And of course, when you're already dealing with low blood pressure, this is a bit of a nightmare scenario. But interestingly, I have literally started on a new medication for POTS 2 hours ago, and I just took my blood pressure, and I think it was 106/58, which is much more within the thresholds of kind of what I'm used to, really, or historically used to. So yeah, that's helping to put my mind at ease, I have to say. And of course, while I'm talking about cardiovascular symptoms, although chest pain is a symptom of MCAS, and I do experience chest pain myself, this is something that will always need checking out. So, you should always take chest pain very, very seriously. Next up is gastrointestinal, so that's your digestive system. And symptoms may include bloating, stomach cramps or pain, reflux, feeling or being sick, diarrhea or constipation, or alternating between the two, dumping syndrome, and food allergies or intolerance. And I know for me personally, I have a lot of these symptoms going on, and food allergies or food intolerance really is a big part of my MCAS. And yeah, I'm just intolerant to so many foods. And when my MCAS was at its worst, I could only eat 3 foods for around maybe 4 to 6 months. So that was chicken, avocado, and what's it called? Sweet potato. And I know that sounds super healthy, but if you're only eating those 3 foods and with no oil in your diet as well, it's really harmful. So yeah, food intolerance is a big one for MCAS. So if you are experiencing substantial food intolerance to quite a wide selection of foods, then I would say that's a big indicator of potential MCAS. And lastly, general. So we've got 2 symptoms here, which is extreme tiredness and anaphylaxis, which of course can be life-threatening. And I think this is where a lot of confusion comes in with regard to MCAS, because I think a lot of people just seem to think it's a problem with anaphylaxis, including a lot of doctors actually, because it's really hard to get a diagnosis of MCAS. It's almost impossible in the UK because I had to go privately. It's something that the NHS just aren't up to speed with at all, unless you're having repeated instances of full-on anaphylaxis. And although many people with MCAS will experience anaphylaxis, it's not something that everybody has. Well, certainly full-on anaphylaxis where you're in extreme difficulty. And I was really interested to learn that there's various stages of anaphylaxis, and it's something that we all should be aware of, really. And I think this is a pretty good infographic. So signs of anaphylaxis includes breathing difficulties and being unable to swallow, hives, itchy rash or swelling, stomach cramps, diarrhea, nausea and vomiting, and a drop in blood pressure, increased heart rates, a weak pulse, and feeling faint. And there are actually 4 stages of anaphylaxis. So stage 1 is mild, and this can include symptoms like skin rash or itching or hives. Stage 2 is moderate anaphylaxis, and symptoms here can include mild swelling in the lips or tongue, Stage 3 is severe anaphylaxis, so there's difficulty breathing, extensive swelling, a weak pulse or dizziness. And a person in stage 3 anaphylaxis is experiencing anaphylactic shock. Stage 4 is life-threatening, and this involves the person losing consciousness. And at this stage, a person needs immediate medical attention. So I think it's really helpful to be aware of these different stages of anaphylaxis. And I know for me, I have exercise-induced anaphylaxis. So I have to be really careful with exercise because it will bring about the first stages of anaphylaxis. So I get a really itchy back, so there's hives, and I'll get really severe stomach cramps, so I'm doubled over in pain, and it makes you feel like you're just going to go to the toilet there and then. It's so horrible. And I'll also have difficulties with breathing, and this was all so difficult to tell my doctor about back then. So I just didn't, because I knew that there'd be no way of trying to kind of capture all of this kind of information to push forward with a diagnosis. But it's only now that I can look back and see that was actually early stages of my MCAS, because this is going back about sort of 15 years or so. But I just thought it was really important to mention exercise in this video, because it doesn't actually appear on the list here, but it's yeah, a really big factor in the lives of many people with MCAS. And also I should mention that many people with MCAS will also either experience or have a diagnosis of ME or CFS or chronic fatigue syndrome. So if you do have chronic fatigue, but you've got a lot of kind of odd symptoms that you can't quite place really, or you don't really know why you're getting them, it may well be worthwhile you looking into MCAS, because it might explain some of the things that are going on for you. So I'll leave a link down below to the Mast Cell Action website, because it's really good. It gives a lot of information about the illness, and the charity itself does really good work. And I know people in MCAS forums that have emailed them to ask for bits and bobs of information, and they've been really responsive actually, so that's good to know. As I say, I think there needs to be a whole lot more awareness around MCAS, because I think a lot of people don't really know what it is, and it's misunderstood even within our health service, you know. So yeah, there's a lot of work to be done on raising awareness about this illness, because it can be just completely debilitating and disabling a condition, and yeah, it just needs more eyes on it, I think. So anyway, let me know if you found this video helpful, if you found any of the symptoms I've given relatable in some way. I'd love to hear. As I say, I'll probably do a follow-up to this video about POTS next time around, and maybe EDS actually as a third video, because I think that's another very misunderstood condition. So anyway, thank you for watching. Give it a like if you got this far, and I'll see you again soon.